I think there is a lot of skepticism when I lecture the general public on the fact that Alzheimer's is reversible.
As a vegan, do you ever feel like you're living in a parallel universe, aware of things that many others don't even seem to notice, let alone acknowledge? I'm Chrissy Benson, host of the Vegan Posse podcast. We talk with vegans from around the globe who, like you, are living lives of integrity and compassion with an eye toward justice. Through their personal stories, you'll come to see that you're not an outlier. In fact, you're part of an entire posse of individuals who aren't just keeping the peace, they're creating it through their food choices and beyond. You won't be saddling up, but you're in for the ride of your life. Welcome to the Vegan Posse. Hey Posse, I'm your host, Chrissy Benson. Happy New Year. May 2025 be epic, fabulous, and rich in every possible sense for each and every one of us, human and non-human alike. If you've got questions for Posse Talk with Jen Hawk, the monthly series I'm doing with Dr. Jen Hawk, email veganposse.email@gmail.com. And if you're interested in internal family systems therapy, also known as IFS, email me at christinembenson@gmail.com. Now for this week's episode, which was slightly delayed due to some tech issues. Dr. Joshua Helman is a Harvard-trained physician licensed in 14 states. He has 2 degrees in biochemistry. He's double board certified by the American Board of Emergency Medicine and the American Board of Lifestyle Medicine. His medical degree is from Harvard Medical School and MIT. He's the former medical director of Hippocrates Health Institute, was on the True North Health Center research team, and was affiliated with Spinagle, I'm probably pronouncing that wrong, Wellness Institute for 6 years, helping to reverse and prevent dementia. He's got some fascinating, highly encouraging news about Alzheimer's disease, which you won't want to miss. So enjoy this conversation with Dr. Josh Helman. Dr. Josh Helman, welcome to the Vegan Posse.
Thanks.
Are you ready for the ride of your life?
I am. That's awesome.
Good. Well, you've got such impressive credentials and are doing so many groundbreaking things, but I like to start back at the very beginning with people. Can you talk a little about where you're from and how you thought about food and health growing up?
Sure. Yeah, no, interesting childhood. My dad's a gastroenterologist, a physician. So at a very early age, I rounded with my dad. I think I was 9 years old. And, he took me to see patients, including, I remember this one gentleman who had ulcers in his stomach because he was drinking beer and eating salami and other foods like that. So I remember from an early age, my dad counseling this patient and me, making that connection that food isn't necessarily good for you. And then I remember being angry that, my next door neighbor was able to get soda pop, but I wasn't. I felt deprived. I mean, now I know he was looking out for me, but as a kid addicted to sugar, it's like, well, why can't I have that?
Right. That makes so much sense. So your father was pretty savvy, it sounds like, when it came to food and nutrition.
100%. For the time, I don't think most gastroenterologists were as prescient as he was. And, he's also he speaks the truth, whether it gets him in trouble or not. And, I saw that it's Veterans Day that we're recording. I think he got into trouble with the military because he didn't like some of the way that soldiers were being treated at Walter Reed. And I remember him telling me this story as a kid, and he ended up getting kicked out of the Army for that reason, but he felt good about it because he was protecting the soldiers.
Wow.
So,
what was going on there? Do you know the details?
Yeah, it was in terms of there were patients who were severely anemic, and instead of being willing to do a blood transfusion, that was it was ignored, and it placed some of the patients in jeopardy. So,
Wow.
so they basically went back into his medical history and found that one lab test that was a little bit off with his liver, and so they gave him uh, a medical discharge. They were going to transfer him to Vietnam. So yeah, it was yeah, but that's kind of the environment I grew up under, where you speak truth, whether it gets you in trouble or not. Yeah.
Interesting. Wow. Wow. And are you an only child, or did you have brothers
No,
and
no,
sisters?
I've got a younger brother and younger sister, and it's kind of funny. My younger brother also became vegan. He's basically a raw vegan, but it was a completely separate path from me.
Huh.
So
Huh. Very interesting. And what about your father and your mother? Were they plant-based, or how did they eat?
no, they're definitely not plant based, but they eat more plants now. Certainly when we come to visit them in California. So, but I've got to say were definitely a lot more health conscious than most of our neighbors. We would go out to eat maybe once in a while, but my dad saw that adding all this salt and other stuff is not health promoting. So.
Right, right. He had common sense, which, as they say, is not so common.
Correct. And, he was willing to dive deep and go with the truth, whatever the truth was. So,
Yeah, yeah. What a role model it sounds like you had. Yeah,
yeah.
very
So,
interesting.
yeah.
So, did you always want to be a doctor? Did those rounds when you were 9 years old kind of infect you with the spirit?
I did in terms of like wanting to take care of patients, but I was also a science nerd. So I remember like at the age of 17, teenager, or 16, getting this big, thick textbook of biochemistry, and just my eyes were completely open. And I was like, you know what? I think I want to be a scientist. That the whole science piece was amazing. But what really cured me of that was taking theoretical physics courses in college and seeing that most of your time as a theoretical physicist, the only other people you're interacting are other kind of nerds, and I miss the human connection, which is why I ended up in medicine.
And you have, for people listening, you have many degrees. You've got master's degree, a medical degree, undergraduate degrees. Why so many degrees? Do you just love to learn?
Yeah, my mind is like a sponge. I think maybe I mean I don't know you well, but from your background too, you've done lots of different things, and my mind likes to stay active, and yeah, I ended up getting two different degrees in biochemistry as a passion, and then I started off actually in surgery, but did training in emergency medicine. So yeah, and then just a dozen years ago, I went from more of the traditional medical practice to, I would say, more of an integrative, functional practice. From my own struggles, I was 50 pounds overweight and had high blood pressure. And it was humbling because, here I am, this Harvard trained physician. I should know how to fix high blood pressure. I should know how to lose weight. And I was having a lot of trouble.
Interesting. Yeah. And I'm curious too, all this time when you were in medical school and the other schools, did you did you ever give any thought to the animals in the food system, or, our food system in general?
Not, not, well, I'll give you an example or two, but normally not so much. I remember when I was in college at Harvard College, people would look at me and say, why are you eating all this rabbit food? Like I liked deep down, I think I like vegetables, but I never made the animal connection. And I will say, when I was a medical student at Harvard, Dr. Neil Barnard came to speak, but it might be different today. But this is 30 plus years ago, And this was not part of the core curriculum. This was like an after school, after class, maybe at 4 or 5 p.m. lecture by Dr. Bernard. And, he mentioned information, say, from the Framingham study that I had studied, and, saying that the vegans or the plant eaters had better cardiovascular health, longer survival. So it connected. What he said made sense. But I looked around and I was not hearing this message from anyone else at the medical school. I know Harvard Med School is different today, but
Mhm.
35 years ago, it was crickets. And I also remember thinking, if I do adopt this type of approach, I don't know that I'm going to survive in this setting. It's a very authoritarian, top down. So if you're doing something that they're not teaching, who knows if you can make it.
Right, right. You're just like a lone wolf, just trying to survive without the herd. Yeah, very,
True.
very interesting. And I don't know if you know this, but I used to live in Boston. I was there for 9 years.
I
And
didn't
in
know that.
fact, that's where my novel, Marrying Myself, is set. It's set in Boston, and that book features a vegan protagonist. So that was my home for quite a while. It was not where I went vegan. I went vegan when I moved to New York City subsequently. But yeah, my neck of the woods. And I'm curious, just as a side note, you've trained and been educated at so many different schools and institutions, both in the US and in the UK. How did all those experiences compare?
Yeah, so I got a master's degree at University of Cambridge in England, and I would say studying in England was a much more, I guess, relaxed approach. But part of that was because I was getting a master's degree. My brother, at the same time, this was back in 1989, was getting an undergraduate degree at junior year, and we compared notes. And his classwork, and it was a much more rigid curriculum. But for me, at the graduate level, it was a much more pleasant learning experience. And I've got to say that uh, there was more food consciousness, such as it was back in 1989 in England, than there was in say, Boston, which Massachusetts, where my experience was. But it was great studying for a year in England because you know there's a whole perspective, not just on England, but the world. There were more graduate students from other places in the world than just England.
Mhm.
And sure, there were some international students at Harvard College and Harvard Med School, but England was much more international, and and really, it, again, humbles you that we're brought up as Americans thinking we're the best, we're great, and we don't really need to learn about the rest of the world. And then you get to England, and you're like, yeah, maybe there are other ways of looking at things.
I mean, that's blasphemy, Dr. Josh, on Veterans Day of all
I know.
day to suggest that there's anything beyond the US that we can learn from. Wow. um, so all this time when you're studying to become a doctor, at what point did you decide you were going to become a medical doctor?
Yeah, so I decided it was probably my first or second year of Harvard undergraduate, so it would have been about 1985.
Okay, and
And
what path did you envision in that realm?
it's interesting. At the time, I actually envisioned getting both a medical degree and a PhD, becoming a physician scientist, and figuring out a way to do both.
Uh-huh. Yeah. So what happened with that vision?
With that vision, I really, at med school, I went to this Harvard MIT program with 30 or 40 colleagues who were just like me, either biochemists or engineers. And and what happened was I really enjoyed the clinical medicine. I like being with patients, and I was like, you know what, let me just focus on patient care. uh, you know the 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 teaching was there is so much to learn about the human body that sure, you could spend time in the lab, and there's nothing wrong with that. But here you are, um, there is, and it's not just the undergraduate and med school training, 4 years of medical school. There's residency training from an additional 3 to 10 years. So so the approach was, this is a very difficult thing to learn, and if you want to be effective as a physician, you just need to go all into it and just trust the system and follow the path.
Yeah, yeah. And where were you with your conception of nutrition and a healthy diet at this point? And how were you yourself eating?
Yeah, so it's interesting. I myself, because I had 2 degrees in biochemistry, or while I'm taking biochemistry courses, I had much more training in nutrition than the average medical student who maybe had a day of, here are the vitamins, enjoy. Um, so, but having said that, I I didn't really know the right approach. I was eating the typical junk food that they would serve in the Harvard cafeterias. I mean, and at the time, it's a little bit better now, but at the time it was mainly fried foods and, processed salt, oil, and sugar. There's some vegetables available, but nothing like um, ideal, unfortunately.
And how is your health at this point?
I mean, I think my health was good, but slowly being focused on patient care, and certainly working in the hospital. I mean, during residencies, etc. Literally, it was a macho thing to work, say, 36 hours on, and then maybe get 12 hours of sleep, and then do it all again, and try to survive with um, basically processed junk food if you get hungry in the middle of the night. So, yeah, I'm not proud of the diet I had. But the reality is, if you're working in a hospital, unless you bring your own food, you're basically stuck with the unhealthy food available. And then if you're in that hospital for 36 hours and you want to bring your own food, you better be bringing a lot of food for that
Right.
period of time.
Right.
Yeah.
So, on the one hand, you're learning more about nutrition from a scientific perspective than a lot of your classmates, but on the other, you're eating this unhealthy diet just by default because of the circumstances. Did you wrestle with that? Was that frustrating, or were you just kind of absorbed in your residency and just making it through?
I think I was absorbed and didn't really, unfortunately, pay enough attention to it. But let me just be clear. I remember studying at Harvard Med School next to uh, someone, a dietitian student, and she would tell me that, yeah, the mornings they teach her how to bake muffins. So I mean, this was, and that was considered a healthy food to serve your patients. So I mean, it's it's yeah, what I know
A
now
little.
is very different than what I had available back then.
Right, right. And what sorts of conditions did you expect to be treating people for? You were still on the surgeon path at this point?
Yeah, yeah. So I was on the surgeon path, and what I found is I liked quick surgical procedures that I would say do in the emergency room, and so I gravitated and eventually switched from general surgery to emergency medicine because you can save people's life, and unlike I did a year of plastic surgery, unlike say spending 12 hours putting someone's thumb back on, you um very quickly you can save someone's life and be done in 5 minutes or an hour, not 12 hours. So
Yeah.
I guess it was more of a lifestyle decision, and also the I like the adrenaline of kind of the stress of the emergency room. I think I enjoyed that part.
Yeah, I can see how that would be just very stimulating. Just the crisis situation and kind of being the savior and just solving the problem in the moment. Yeah. So what happened from there?
Yeah, so I ended up, it's interesting. I ended up going to practice in emergency medicine practicing actually in 14 different states around the
I
country.
saw that. That's amazing. Again, what's the story there?
The story is I was actually going through a divorce, and I enjoyed travel. And, I was thinking there are these locum tenens temporary positions available where they would actually pay for you to travel and live in different locations around the country. And I was like, you know what? I think this would be a great way to travel, basically get out of my rut and travel and see the country on someone else's dime. And that's what I ended up doing.
So where all did you go? Do you remember
Um,
all 14 states?
I could probably list them, but yeah, so I went to places like Memphis, Tennessee, and Michigan, and New York, and I mean, I was in Florida, so definitely some places in Florida, and Idaho, and Nevada, New Mexico, yeah, North Carolina. It was basically all over. So
Wow.
it
Wow.
was it was it was fun, and it wasn't just, it was both rural and big city. It was a mix. So I got to see the country. I mean, I can't claim to say I didn't go to every state,
Sure.
but uh, again, just like going to a foreign country or meeting people from around the world. It's humbling recognizing that not every city, not every state is the same, but it was exciting. It was an exciting experience, and I'm grateful for the time I had.
Yeah. Yeah, that sounds really interesting. Um, did you get any like general senses of people's health in these various places? Were there any kind of big picture themes you noticed?
Sure, I'd say big picture. Well, first of all, in the rural areas, it felt like a huge food desert where I would basically have to bring often my own food, and it didn't make any sense because these were rural agricultural areas, but often there wasn't there weren't good vegetables or food there. I would have to bring my own. Um, yeah, so that was surprising.
Wow. So the areas that are growing the food didn't have access to the healthy foods.
Yeah, which
And so,
which is really sad. Like, you
yeah.
could go and buy processed food in the small market, and there'll be like a McDonald's or a fast food place, but there wouldn't be amazing farmers markets or what have you that you could shop at.
Mhm. Yeah. And so was it during this period of time that you went vegan or when did that happen? That
Yeah,
you
actually,
changed your own diet?
yeah, it happened about a dozen years ago, and it's kind of funny. It happened during a trip to Las Vegas, a conference there, um, with the CEO of Whole Foods, John Mackey, was was giving a lecture at this conference, and there's a room of maybe 40 of us, and he basically said, when you go to my store, Whole Foods, only buy, say, 5 or 10% of the things for offer, specifically the whole fruit, the whole vegetable, and the whole grains. And don't bother buying anything else in my store. Just focus on those things. And to me, it didn't make any sense. Like, what CEO in his right mind is going to say, don't buy 90% of the product in my store?
Yeah. Yeah. And this was obviously so it was a group of physicians or who all was his
No,
audience?
no, this is
Just
actually
anybody interested?
this was a libertarian conference, and
Oh,
it was basically there were different lectures and kind of breakout sessions, and if you're interested in health, you know, come hear John Mackey speak, and
yeah.
yeah.
Very interesting. And so did you yeah, did you leave there having made a decision to change how you ate?
Yeah, I wish I could say I went there and I made the decision. I was like, you know what, this this sounds good, but I'll just be honest with you, I heard it. And then it took me going back to the same conference the next year, listening to the same lecture. This time I actually read the China study. He was like, and you should go read the China. This time I actually read it, and then, but I'm upfront with people. It took me years to make this transition, and specifically, I made the decision in Las Vegas. okay, I'm gonna, sure, the ideal thing is to cut out all meat, all milk, dairy, cheese, eggs, everything. But you know what? I'm just gonna cut out the meat because what's the least I can do to improve my health?
Mm-hmm.
And so I
Mm-hmm.
did. I cut out the meat, and I actually got withdrawal headaches for the first week or two. So
Interesting.
it was a true addiction that
Interesting. Were you eating a lot of meat in your diet? It sounds like.
I think I had some. I don't think I probably had some type of meat every single day. Yeah,
Yeah.
it
Yeah.
wasn't every meal like some people, but it was a real thing, and I think cutting out the meat and the fat, um, yeah, it's just like cutting out caffeine. You get a withdrawal headache, and
Yeah.
and
Yeah.
but yeah, go ahead.
No, I'm just curious, even aside from you personally, I'm curious how John Mackey's message went over at a libertarian conference.
Yeah, I mean, I think, well, first of all, as a successful businessman who is, you know, he was honored for that. It's like
Mm-hmm.
look at all the jobs you created,
Uh,
and the quality of food that you've provided to society. So he was applauded for that. Now, in terms of did of the 40 people in the audience, did he was he able to convert or uh, get them to change their diet? I don't know.
yeah.
Um,
Yeah.
but like for me, it took a year to hear it again and say, you know
Yep.
what, this is the right time for me to do it. But even so, it wasn't. He helped me cut out the meat, but it wasn't. I'll be upfront. It wasn't until I took this vegan cruise with Chef AJ, and hearing her say that cheese is not a health food, that and saying, you know what, you're right, because I at that point read more and saw that cheese is loaded with carcinogens and toxins and other things. But from hearing John Mackey to Chef AJ, that was about 3 years. It took me about 3 years from wanting to make changes to being going completely vegan. So
Mm-hmm.
when I talk to people, I say, like, if this is hard for you, I understand it was extremely hard for me. And unlike some people I know where once they hear this message, they can make that change overnight. For me, it took a few years.
Yeah. Yeah. Well, thank you for sharing that. That makes total sense to me as well. I was a non-vegan vegetarian for a long time. I wasn't eating cheese because I did know that cheese wasn't a health food, so I had ruled it out. But I thought non-fat dairy like Greek yogurt and I thought egg whites and that sort of thing were healthy. So yeah, it is really interesting just how our perspective changes. These things that seem obvious to us now often seem so extreme, back in the day. And I don't know if this is true for you, but for me, I remember certain thoughts that used to go through my head that are just so wrong, that are just so misplaced. And it's funny to think that it's my same brain, the same me that was thinking all those thoughts and doing those things.
But a lot of those thoughts I see now lecturing to the public. A lot of those thoughts originate from messages that I and other people hear from the media.
Right.
Um,
Right.
so
Right.
yeah,
Yeah, I totally agree. Yeah. And in fact, in a recent episode of this show that I recorded, I just mentioned that a lot of people, when I ask if they ever thought about the animals in our food system growing up, and I asked that question out of curiosity, but people um, tend to feel a little bit guilty or a need to apologize for not having thought about those things. And at the same time, like you said, our society proactively conditions people to not think about those things. So yeah, it's no accident that we end up thinking and being the way that we are, because there's a whole orchestrated agenda, calculated or not, but it does affect our ability to think independently and critically about what we're putting in our body.
that's
Um,
that
so
and that
mhm.
was my experience too. Yes.
Yeah, yeah. So meanwhile, when you're traveling around, when you learned this, when this message got through, you started making changes for yourself. Did you contemplate how that would affect your medical practice?
Yeah, no, it's interesting. I really didn't. I didn't see, at the time, emergency physician who's, using changes with my own diet to try to lose the 50 pounds of weight and control my high blood pressure, in addition to learning how to put more functional and integrative approach to medicine. So I didn't have a master plan. I didn't foresee that I would be reversing Alzheimer's in patients like I'm doing today. I had an open mind and a confidence in. I've had some amazing training. I know how the human body works biochemically. I know from a macro level how to get people's organs working when they're not working. And I'd also seen in emergency rooms, people would come into the emergency room for second, third, and fourth opinions because their primary doctors or specialists couldn't fix the problems.
Mm.
So I knew there was a huge need out there, but I didn't have a dozen years ago, I didn't say, oh, someday I'm going to be reversing Alzheimer's like I am now.
Yeah, yeah. So tell us how that all came about. Tell us what happened, how your practice evolved, and just how your own conception of health and food evolved.
Yeah, so it's fascinating. So one other piece of the puzzle on learning about veganism, this really from a health perspective, was attending a 10-day conference. I lived in Orlando, Florida, and it was called The Real Truth About Health. And it was an in-person 10-day conference for free. It's like, what conferences are for free? And most of these lectures were outside of the traditional rigid medical space, but they were about medical topics on how to reverse disease using eating plants and avoiding toxins. So so that also changed my mind. And one of the sponsors for the Real Truth About Health was this place called Hippocrates, which is a raw vegan retreat in West Palm Beach. And I was so enthralled with the idea. I approached Brian Clement and I said, if you're ever looking for a doctor, I'd be interested in working. And 6 years ago, he took me up on the offer, and I became the medical director there for a year. And it was so amazing watching all these chronic diseases, whether you're talking about high blood pressure or high cholesterol or being overweight or cancer or rheumatoid arthritis, all these chronic diseases would get better once you got people off of the traditional sad American diet and you improved not just their diet, but also their lifestyle. And I would see this on a daily basis. So I was there for a year, and then I went to True North, which is a fasting center in Northern California, for a few years. And the same thing, if you get people to water fast or not eat all the awful things that um, our standard Western diet provides, a lot of these chronic diseases go away. People lose weight, etc. So from both of those experiences, I was like, it may not be what people are doing, but what they're not doing is almost just as important.
Right, right. It's so interesting. And throughout all of this, how was your own health? Had you lost those 50 pounds? Like, how difficult was it to put this knowledge into practice?
Yeah, I mean, my own health was improving year to year. It was amazing, and I I was no longer traveling every week, to some different city uh, in the United States. I could actually focus more on exercise. So with exercise and cutting out salt, oil, and sugar, I learned that basically at True North. My health dramatically improved. So my energy level went up. I felt really amazing.
Wow. And how old were you at this point?
Gosh, I was late 40s. Yeah.
Okay. Yeah.
Yeah.
Yeah. And were you talking to your brother about your process at all? Had he made the shift
Yeah,
for
yeah,
himself?
yeah. So you should have him on this on your show at some point. But
Love
but
to,
but
yeah.
he's been very public about this and published. Um, he was actually homeless and schizophrenic. And he tried the anti psychotic medications, which caused him to put on a lot of weight, but really didn't fix his schizophrenia. What actually fixed his schizophrenia was switching to a raw vegan diet. And
Wow.
so he's published 3 papers on this. And
Wow.
yeah, his name is Daniel Helman, Helman. If anyone wants to look it up, he's a PhD scientist. And yeah, but the amazing thing is, while he had his own journey, I was on this journey, and
Hmm.
it was parallel. It wasn't like, oh, that worked for you, I'm
Hmm.
going to try this. No, it was like, wow, we ended up very similar.
Hmm. Hmm. Almost like in the movie Forks Over Knives, where they show Dr. Caldwell Esselstyn and Dr. T. Colin Campbell, on these parallel paths leading them to the same conclusion.
100%. Yeah.
That's very interesting. I mean, that sounds very difficult, obviously, what your brother was dealing with, and I'm sure that had ripple effects for your whole family.
Oh,
That's wow.
definitely. But, at the time, like, I wasn't thinking, oh, this was, decades ago. Oh, he's going to change his diet and his erratic behavior is going to get better. Like, yeah, we did not at the time I didn't put that together.
Yeah, it really strikes me as just even for people like us who are aware of some of the power of food and the body's capacity to heal, even for us, it's sometimes, seemingly miraculous when that does happen, through food
Right.
and
But the
time.
other thing is, just because we can talk about it or publish papers or read papers about it, it's one thing to have that knowledge. It's another thing to put it into place, because I mean, I had a real food addiction to the fat, salt, oil, sugar. Yeah, I was brought up addicted to all these animal products.
Yeah. Yeah. 100%. Yeah. So when did you start getting interested in Alzheimer's disease?
Yeah, so it was about 7 years ago. I was actually looking for a job in Tampa, Florida, and a friend of a friend said, "Oh, there's this lab that does dementia work and Lyme disease and mold toxicity. It's called Spinagle Wellness, and you should go interview with Dr. Spinagle." I'm like, okay. So I interviewed there, and he shared with me that he's had lots of doctors come through, and no one can understand what he's doing, and it's a very complicated system, and it was extremely complicated, doing different IV therapy every single day using basic biochemistry, neurotransmitter levels, PET scans of the brain with neuroquant imaging, and then measuring toxin levels in the blood and urine. And because of my 2 degrees in biochemistry, I totally got it. I was like, you know what, you're doing the right thing. And I hadn't seen anyone. I mean, I'd practiced all over the country. I hadn't seen anyone doing what he's doing. And I was like, you know what? Let me work there. And so for 6 years, I was basically reversing Alzheimer's and other dementias, giving people their function back. They could go back to work, or, be functional again. And unfortunately, a year ago, Dr. Spinagle lost his vision and had to close his clinic. And I was left with the dilemma. All right, what do I do next? I mean, I've been helping all these people. I want to
Yeah.
continue doing that. And I decided to move from Tampa down to South Florida. At the time, Brian Clement at Hippocrates wanted me to come back. And I said, I'm happy to come back to Hippocrates, but just understand, I also want to set up clinics in order to reverse Alzheimer's. And that's what I've done. I'm back as the medical director at Hippocrates, but I've also got 2 other clinics, one called Brain Power and the other called Alzheimer's Treatment Centers of America. And our vision is to set up clinics basically in every city in this country because there's such a need. Alzheimer's is exploding. We've got 7 million people in this country with Alzheimer's, and it's reversible. But unfortunately, that information hasn't caught up with the traditional care that most patients are getting through the standard neurologists or primary care doctors.
Right. Well, that's incredibly fascinating. And obviously, the common perception is that Alzheimer's is not reversible. So people, you mentioned that just to the average person on the street, and nobody believes that to be the case. So tell me first, what were you all doing at Spinagle to reverse Alzheimer's?
Yeah, so the first thing is finding the root causes. And often the root causes were things like toxins from mold, from heavy metals, from plastics, from other petrochemicals, from parasites, from viruses, Lyme spirochete. And often it's not just one or two things. There are between 30 and 100 root causes. So what the approach is, the first thing you have to do is to remove the toxins. And this is one point that I don't think is emphasized even among vegans, is that if you're eating animal products, you're getting 10 times more of these fatty toxins, whether it's the BPAs or the PCBs or just plastic, than if you're just eating from lower on the food chain, whether on land or sea. So to my mind, from a health perspective, the reason you don't want to eat animal products is you don't want the toxins that are associated the higher up you go on the food chain.
Interesting. Yeah. Yeah.
So it's the same thing. Like I wouldn't eat food that's been covered in dirt, but that's essentially what you're doing if you're eating animal products. And yeah, so what we would basically do is first we would do detoxification using IVs and colonics, and then for patients with infections, we would treat with antibiotics, and then some great tools came available, specifically exosomes, which are stem cells without the cells. These exosomes basically allow the body it's a collection of 500 different growth factors, and these growth factors would allow the brain to regenerate. And yeah, no, that's so it's basically layering on several different treatments. And then I'm just so excited because now there's this brand new FDA approved drug for compassionate use that no one's heard of that decreases inflammation in the brain. And we're starting to use things like total plasma exchange to remove all the toxins in the bloodstream, including forever chemicals, which again, these industrial toxins that are much higher concentrations in animal food, animal products.
Fascinating. I mean, it all sounds way beyond my way beyond my science training for sure. Um, how advanced cases were you able to reverse in people?
Yeah, no, it was amazing. I took people, or we took people who, couldn't recognize, didn't know what day it is, what year, and they were able to go back and have not just function a little bit, have a real life, go back to work, be productive members of society. It was fascinating. And but I've got to tell you another story because I know you have a personal history with seizures. Some of our patients, in addition to the dementia, they would have seizure disorders. And if we took and they had such high levels of electricity in their brain, high levels of toxins and infections and inflammation of the brain, is that if we actually sat two of these patients next to each other, the seizures of one patient would trigger seizures in the one next to them.
Oh, interesting.
So we would have to keep them on different parts of the room just so we weren't triggering. Yeah. So this is when I say like there's an electricity in the brain. Yeah. You want to decrease that level normally for people with inflammation. Yeah.
Fascinating, fascinating. And how long does it take for most people to, because this all sounds very complex. I mean, is it really necessary, or did you find it necessary to identify the specific toxin, or was it just enough to know that there are toxins involved in the most across the board effective way of reducing those toxins is to get them eating plants rather than animals?
Yeah, so it was important to identify the specific toxin and to know the levels, say, of like heavy metals, mercury, etc. And we would repeat toxin testing every month, and it was important to track it to make sure that we were going in the right direction. I will say, when I started, say, 6, 7 years ago in this, we were doing a full year on average of intensive daily IV therapy. But with the exosomes, with the regenerative peptides, we were able to get that down to 3 months. And,
Wow.
and, and I'm optimistic now that it's going to take us even less time with some of these newer FDA approved drug for compassionate use, and then also with the total plasma exchange, that we're basically giving patients options like, do you want to come in every day, or do you want to come in once a week or once a month? We have a plan for everyone, especially depending on how advanced their dementia or Alzheimer's is. The more advanced it is, the more rigorous and intensive you have to be to reverse it. And frankly, I think prevention is the way to go, because it's a lot easier to prevent a chronic disease than to reverse it. But alas, our current healthcare system, it may be changing, but our current system is, you're not allowed to have insurance coverage to to prevent. You have to wait until you actually have the full-blown chronic disease, and then and only then are we allowed to try to reverse it.
Right, right. It's an upside down system in many ways. All these treatments sound fascinating. They also sound very expensive. I mean, how does the cost play in, and what's the cost like?
Yeah, no, I mean, unfortunately, it was expensive. We were able to get some insurance coverage depending on the insurance. Like, there's certain conditions that insurance companies will recognize, like they will recognize certain mold toxicity, but and they will recognize acute Lyme disease. But for some reason, chronic Lyme or chronic infections, the insurance companies are like, oh, that's not real. But to your point, yeah, many of the new treatments I'm talking about, they're expensive, and insurance won't cover it because it's considered cutting edge. But frankly, you look at the alternative. I mean, the cost of memory care or a memory institution is actually a lot more. So
Mhm.
I think the value of the service we're providing is tremendous.
Yeah, it certainly sounds like that. And so I'm curious too about compliance, people leaving your clinic, finishing the treatment, if they go back to how they were eating beforehand, which I would imagine a lot of people, it's easy for them to lapse into that old way of doing business.
It is, especially you go back to society, and we don't live in you know, a plant-based society. Even though this is obvious to us, and I've surrounded myself with other people who believe like you do. I mean, if we're objective, we're talking about, say, 1% of the population in this country. But it's not just the food exposure; it's also mold. Many of these patients also, it was mold exposure, it was mold toxins, and 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 mold spores that were causing some of these problems. And if they went back to a moldy house, within a week, their symptoms would return. So compliance is very important, not just from the food perspective.
Yeah, and how do people respond to this messaging? I mean, do they believe you at first? I would imagine there's a lot of skepticism.
Yeah, I think there is a lot of skepticism when I lecture the general public on the fact that Alzheimer's is reversible. About a third of the patients, not the patients, a third of the audience will tell me, well, we all know that Alzheimer's is not reversible, and you're saying it is.
Dr. Josh Helman, welcome back to the Vegan Posse.
This,
we had some technical issues last time. So are you ready for another ride of your life?
oh
Part
yeah,
two.
let's do it.
Okay, excellent, excellent. So last time we were talking about your professional path as a doctor and just figuring out, the best way to help people with the issues that people are facing right now, namely Alzheimer's disease, which is a disease that many people think of as the worst possible fate and as completely incurable and, just a complete chance of fate and nothing we can do about it. So when did you first start to question that common perception of Alzheimer's disease?
I think I started questioning it maybe a dozen years ago, but I would say for real about 7 years ago when I met a doctor in Tampa, Florida, actually doing it, actually reversing Alzheimer's and dementia. And, and I'll be upfront, I was skeptical initially because of what I've been taught and told. But I mean, there's definitely been an undercurrent of the importance of regenerative medicine. And having 2 degrees in biochemistry, I could actually analyze the steps he was taking. And even though I was skeptical, I was like, wait, all these things, all these tests add up and they correlate with the pictures he's showing, both of on blood slides, but also, most importantly, PET scans of the brain with something called neuroquant imaging, where you could actually put an objective number and a picture to different parts of the brain. And then you could actually, I mean, the brain is amazing in terms of how different parts of the brain control different functions or emotions. And once I got good at reading PET scans, it was almost clairvoyant. I could basically pick out someone's personality. It was kind of crazy.
Really?
Yeah.
Yeah. Say a little more about that. I'm so intrigued.
Yeah. So, I mean, it turns out that, so for example, the frontal lobe is responsible for what's called executive function. And there's a part just above the frontal lobe called the uh, anterior cingulate that controls impulse. And we would see patients with hyperactivity, ADHD type symptoms would have uh, overactivity in the anterior cingulate and sometimes the posterior cingulate. And you could also see parts of the emotional system where both in the hippocampus and throughout. And then, but using this basically 3D map, you could measure someone's brain activity and compare it to what 100 normal people that age, what their brain should be working. So I don't know. It was just it was amazing, and we could use it to make diagnosis because if someone had fatty toxins, like plastics in their brain, it would normally accumulate rather diffusely throughout the whole brain because there's no reason like a plastic fatty molecule, why would it want to go to one part of the brain as opposed to the other? But infections would clump in specific parts. So, for example, if it was a mold infection, often mold will grow in the sinuses, behind the nose, and then would travel up through what's called the ethmoid sinus cribriform plate into the brain, the medial or middle portion of the frontal lobe. And we would see a correlation. People who had mold in their sinuses would also get these mold infections in the middle of their frontal lobe. So things like that, which, isn't well documented anywhere. But again, I was skeptical until I started seeing correlations. Oh, they have positive mold testing from their sinuses, positive mold in their urine. Oh, and the middle of their frontal lobe also had the same pattern. So once you started seeing hundreds of patients and then correlating their clinical course, it became easier to understand how the brain works, and when it doesn't work well, what's going on. Another test we would use are neurotransmitters, and certain neurotransmitters are very important for normal brain function. And if those neurotransmitters were either too high or too low, the brain wouldn't function normally. So we basically had, I would say, 100 different dimensions of data. And not the first time, but as you start seeing patterns and put the patterns together, our brains were able to say, oh, this is what, these are some of the causes for this person's dementia. What we now know using AI is that for every case of Alzheimer's, there are between 30 and 200 root causes, but each case is a little bit different. So you can't say, oh, I've seen one case of Alzheimer's, I've seen them all.
So what role and what impact does eating, a healthy vegan diet, a whole food plant-based diet, how much protection will that afford, the regular vegan person?
Yeah, so I think that's important. I think it's definitely helpful because we now know from studies that the more plants someone eats and fewer animal products, it turns out that animal products have roughly 10 times the amount of fatty toxins like plastics and DDT that plants do. Not that fruits and vegetables have zero, it's just 10 times less because it's further down on the food chain.
Right. Yeah, that makes sense. Yeah. So if there's just plain old contamination, it's going to be intensified and multiplied in the animal products because they're eating the plants. And
no, it makes sense. And it's been studied. There was a French study in 2017, comparing levels in vegans and non-vegans, and the non-vegans or the meat eaters had 10 times or more higher levels of these fatty toxins in their system. So it makes sense. You are what you eat, and that's what the studies show. But
right.
but I would say it's not good enough just to be vegan from a health perspective. You want to avoid vegan fast food or junk food because take Oreos in this country. They may be vegan, but they're not health promoting. There are lots of added salt, oil, and sugar that will do damage to your blood vessels in your brain, etc. So what I say is, eating fruits and vegetables, being vegan, it's a good step in the right direction. I would definitely recommend other things, and I would avoid adding lots of salt, oil, and sugar to your diet. So it's not just about being vegan, it's being a healthy vegan. And I understand there's some people who are like, I'm just vegan for ethical reasons. I don't care about my own health. I'm going to eat all the junk food I want. And, I can't stop them, but I can just say, at some point this may catch up with you and you are going to care. It's a lot easier to prevent Alzheimer's than to reverse it.
Yeah, that makes sense. Can we do just a quick segue to talk a little about coconut oil? Because there's a lot of people in the alternative health world who, claim that coconut oil is like a cure-all for Alzheimer's. And my impression is that coconut oil is not health promoting. But what's your professional opinion?
Yeah, I'm not a fan of coconut oil for brain health because it's very high in saturated fat. Now, but you might argue, well, it's better than butter. Yeah, but butter is not good to start with. So,
right.
And it's not just brain health. I mean, there are studies, and I actually saw this in my own brother during COVID. He was basically stuck on an island in the Pacific. And as a vegan, as basically a raw vegan, he ate a lot of coconut because there weren't a lot of other sources of food for him in this island of Micronesia where he was a teacher. And he put on a lot of weight. And but it's not unique to him. If your diet is mainly coconut oil, coconut water, not as bad, but the coconut oil, very high in saturated fat. I understand it tastes amazing. It tastes amazing because our brains are trained to want the fat.
Yeah.
But in this case, it's not good fat and it's not good for your brain in general. Now, if you're talking about someone who's, severely skinny, cachectic, needs to put on weight, yeah, I could see using coconut oil or whatever oil, the most calorie dense food to help someone gain weight. But that's not most people. So I'm not saying never, but for most people,
Yeah.
coconut oil is not going to be your friend.
Yeah, thank you for clarifying that issue. It's frustrating to me because sometimes I hear these alternative health gurus who, who speak so much sense about health and nutrition, but then they seem to have this blind spot when it comes to coconut oil. And not only do they think it's okay, but they seem to think that it's a cure-all for Alzheimer's. And it's just, it's it's frustrating to hear about. I'm a fan of coconut oil for oil pulling. I don't know if that's a practice that you do. That's basically you don't swallow the oil. You just swish it around in your mouth for several minutes, and it cleanses and detoxifies your gums and your teeth, and makes your mouth feel really clean afterwards. But
yeah, I'm okay with that. I'm also okay using coconut oil to clean your hair if you want, but
topical
yeah,
uses, right,
yeah,
right.
yeah.
So beyond the whole food plant-based diet, what are some other just practices and habits that you would recommend for, preventing Alzheimer's? We'll talk about preventing it first, and then we can talk a little more about your work actually reversing it.
Sure. Well, it's a lot of the things. It's a lot of typical lifestyle medicine. Eat the right food, specifically avoiding added salt, oil, and sugar. Eating lots of fruits, vegetables, whole grains, and avoiding animal products. That's the food category. You want to get plenty of sleep. You want to decrease your stress, get lots of exercise, connect with the community. So you want to put that all together. So the lifestyle changes can
Yeah.
definitely be helpful.
Yeah, I'm curious, do you have any experience with or any just information regarding some of these pharmaceutical remedies that have been, come up with for Alzheimer's? Because just in my work as a lawyer, I've been involved on some cases involving some of those drugs, and I have a particular impression of those and some inside information as to the pharmaceutical companies, just sales and marketing and attitude toward the doctors who they expect to prescribe these drugs. But yeah, what do you know about these drugs and their effectiveness or lack thereof?
Yeah. So first of all, I'm not against pharma or any company trying to make a supplement or drug to help, but I'm aware of some of the crazy practices that just are not ethical. But in terms of the first round of medications, things like Aricept and Namenda, both of those medications, they help. Aricept helps raise the amount of acetylcholine in the brain, and acetylcholine is one of the key neurotransmitters. So it makes sense as we increase those levels, someone's brain could improve. I'm sorry.
Oh no, no problem at all. So just on a layperson's level, can you explain Can you explain for the lay people in the audience, myself included, because we all have a sense of what neurotransmitters do, but what exactly do they do and what can go wrong if they're not working properly?
Yeah, so it turns out that neurotransmitters are the way that nerves transmit information through junctions between cells. So
Okay.
it's the information conduit.
And what
And
happens if they're not working properly? Is it that our thinking gets muddled, or we just don't think as quickly? We have trouble putting sentences together, and
yeah,
like what?
exactly right. So the opposite of acetylcholine there are uh, cholinesterase. I'm sorry, there are blockers of acetylcholine, and one common example is Benadryl that people will take for allergies and or if they get sleepy. And I'm not saying never take that, but what I am saying is that if you chronically take Benadryl or another choline acetylcholine blocker, your brain's going to suffer, and it's not good long term, and that can lead to dementia.
Interesting. Yeah, that I did not know. And is that cumulative, or is that something that stops once you?
Yeah, it is it's cumulative.
Oh
So
wow.
again, I'm not saying never take Benadryl or a medication like it, but I am saying, like, if you need an antihistamine right now, then take an antihistamine. But you know, be aware that if you are relying on Benadryl every single night to get to sleep, you're not going to get good sleep, and your brain's not going to be functioning normally because there's not going to be enough acetylcholine, and then you're at risk for dementia. And you're right, most doctors don't know this. The good news is when we work with patients, we can actually look and see what medication someone's on, and often substitute one that doesn't have the same side effects with acetylcholine.
Interesting. Yeah. I mean, I'm fortunate in that I live a life that's medication free. So, I don't have the day-to-day experience with these drugs, but it's a reality check for me when I'm talking to kind of, just more conventional people, that a lot of people just do take these, drugs and these prescriptions on a regular basis. And yeah, that's interesting to know that they can have long-term damaging effects.
Right. But I'll give you another example from a new class of prescription medications that block amyloid. An example is Leqembi, which a third of the patients on this medicine get swelling or bleeding of the brain,
Oh,
to the point where if you want to take this medicine, they make you get a brain scan every month.
wow. Wow.
And so that's why I'm not a fan of that drug. So yeah.
Interesting. I'm curious too. Just are there any equivalents to Alzheimer's disease in non-human animals
Hmm. I
or
mean,
Alzheimer's itself?
not really. There really is no good animal model. I mean, they've created like rodent models that don't really. I wouldn't trust them because they're not the same as humans. So no, I'm not aware of a good one in other animals.
So why do you think that we humans get this disease when other animals don't?
Wow. I think it's knowing now that it's between 30 and 200 root causes. Many of these root causes are related to toxins.
Right.
So, some are infections, but many are related to man-made toxins that frankly weren't around, more than 100 years ago. So, and not that Alzheimer's didn't exist or dementia didn't exist in the historical record. But yeah, but I mean, like, or another example, alcohol. Alcohol as a toxin to the brain causes cancer. I don't think people should be using it, drinking it. And if you stop drinking, you're less likely to get dementia. So
Right. Which is just it's such a mundane substance. People don't even think about that. Yeah, in terms of chronic disease. Yeah, it's very interesting. So why don't you talk a little about your success in actually reversing Alzheimer's? What have you been able to accomplish, and how far into the disease progression have you been able to kind of reverse those symptoms?
yeah, it's exciting. We've been able to reverse very severe Alzheimer's and give people their brains back. Now, it didn't happen overnight, but it's exciting. It seems like every few months there's a new modality, a new step, but the game plan is you optimize someone's lifestyle, what they're eating, exercise, etc. You then try to decrease their inflammation, and we're using a new FDA approved drug for compassionate use that decreases inflammation by decreasing a lectin. It turns out that people have lectins in us that cause inflammation when they're too high, and we're able to decrease that lectin. It's called galectin 3. And then another technology that we just started using that I'm really excited about is called total plasma exchange, which has been used for over 50 years.
Huh.
It's a way to filter someone's blood, and specifically we're filtering out the fatty toxins that are
Wow.
in the brain and other tissues.
Wow. How do you do that?
And you basically you put an IV in both arms, and you take the blood out of one arm, you put it through the filter, and then it goes through the filter, and then it goes back through the other arm.
Oh, that's amazing. And how much does this cost, for one? How expensive are these treatments?
Yeah. So right now, total plasma exchange is about $10,000 a session, and you normally need about 6 to clear out all the toxins. But I anticipate as this becomes more common, the price is going to drop.
And so what sorts of tangible results do you see? How quickly do you see the results, for instance, after someone has one of these sessions?
Yeah. So what's interesting is it's not linear or stepwise, but in general, after just one dose of this new FDA-approved drug for compassionate use to lower inflammation, we're seeing some improvement. So, like their score may go from a 15 up to a 17 out of 30. Yeah.
And does it sustain? Does the improvement sustain? Yeah.
Yeah, but every case is a little bit different. It's yeah.
And how amenable are most of your clients to, the lifestyle changes? Because I can imagine that some people would be willing to come in for, an expensive procedure, but it's, more of a challenge or more of a stretch for some people to actually change how they live and eat.
Yeah, everyone's different, and I just try to meet people where they are and not judge. So
yeah.
There's some people who are all in, and some people in a little bit.
And so for the people who are able to reverse, some of these disease symptoms, what does the rest of their life look like? And how much time would you say it gives them? Because Alzheimer's is fatal, correct? Generally speaking.
Yeah,
I mean, a human being is fatal, so we're all going to die regardless. But
No, but it's cool that the same things that we do to reverse Alzheimer's also turns back their biologic clock. So often we're giving them an extra 10 or 20 years or longer.
Wow, that's amazing. And 10 to 20 years of actual living and actually being present. Yeah.
High quality life. Yeah.
Right. And that's a gift to the families as well, just in terms of everything, the caretaking and just the pain and suffering. That's amazing. I mean, how does that feel for you as a doctor to be able to offer this to people?
Yeah, that's great, especially knowing that we're on the forefront, that there aren't a lot of other doctors doing this. And that's why I decided to go into this, because I want to spread the word and help as many people as possible.
Yeah, yeah. One term I'm curious about, you mentioned that they're using a drug for compassionate use. What does that mean exactly?
Yeah, it's under the FDA right to try rule, which basically when there's a drug like this one where there really aren't any side effects
Mhm.
and there's huge potential, but when it's has only gone through a couple stages of the approval process, and it might be 6 more years till final approval, the FDA is like, no, we're not going to make people wait 6 more years if they want to try. So it's right to try.
Okay, so it's like different from off-label use.
Correct. Off label would be if a drug was approved for one
Mhm.
condition and a doctor says, well, I want to try it for a different condition.
Okay. Yeah, that makes sense. All right. Well, where can people looking for help with these issues, find you?
Yeah, a couple places. Probably the easiest is going to be my website, which is Dr. Josh. Sorry about that. Yeah, it's drjosh.com, drjosh.com. And my email address is drjosh@drjosh.com. And on social media, it's Green Brains MD. Green Brains with an S, MD.
Perfect. Okay. And yeah, and how do you feel about Alzheimer's? Do you feel pretty confident that you won't ever, have to deal with it, or, has working in this field removed some of your fear around this, really dreadful disease?
Yeah, I no longer fear it like I did when I was a teenager. And it's great to be able to bring that same viewpoint to others.
Yeah, yeah, I can imagine. I mean, to be a doctor and to really be able to help rather than just kind of treat and, medicate must be why you got into this field in the first place, I would imagine.
Oh yeah.
All right. Well, final question, which I like to ask all my guests. Is there a particular word that for you sums up what being vegan is all about?
Yeah, it's the word clean, because if you're eating vegan, you're not eating animal products with high levels of toxins.
Perfect. Yes. And I think I would argue, and I think a lot of people would agree that it's also being, spiritually clean and,
Oh yeah,
having a clean conscience too. So
true.
it all goes hand in hand, which is quite coincidental. All right. Well, thank you so much for joining us, and thank you for the part two, and for bearing with our plethora of technical issues. We wish that people have fewer technical glitches in their brains than than I've had on the podcast. Um, we close every episode by taking 30 seconds of silence for all the suffering animals, human and non-human, who desire, as we all do, safety, happiness, and the freedom to live out their lives without interference. So, Dr. Josh, I invite you to join me in 30 seconds of silence for the animals, and we'll conclude with the sound of the bell.
Thanks, Chrissy.
Thank you, Dr. Josh, and thank you, Posse. See you next time. Until then, stay strong and stay true.
Thanks.